Do all gallbladder stones require surgery? The answer is definitely no. Surgery is not required for everyone, but in certain situations it becomes very important. First of all, we need to know what is the cause for pain. Gallbladder stones are very common problem. Many of us have been diagnosed only during an ultrasound scan, and most of the time it is incidental finding. So before opting for surgery, we should know whether our pain is definitely because of gallbladder stones. So what are the symptoms gallbladder stones usually cause? First and most common symptom is pain. Pain usually in case of gallbladder stones is situated in the right upper quadrant of the abdomen, and typically it aggravates on eating oily or fatty foods. And the pain usually because of gallstones radiates to the back or right shoulder, and sometimes it can be associated with nausea or vomiting. So pain is the most common indication for surgery in case of gallbladder stones. Sometimes it can be associated with inflammation, that is thickening of the gallbladder wall, as we call it as acute calculous cholecystitis. So this is an acute condition again which will be an indication for surgery. Sometimes surgery becomes urgent and it's inevitable because of complications what gallbladder stones cause. So this can include pancreatitis, that is when stones pass from the bile duct and cause pancreatitis because of blockage of the duct. In case of empyema or gallbladder, where it causes blockage of the gallbladder itself, neck of the gallbladder itself, so that is also an indication for surgery. And when these stones block the bile duct, it can cause jaundice and infection of the bile duct, and definitely it is also an indication for early intervention. So without pain also there are few indications for surgery in case of gallbladder stones, such as the size. The size, if it's more than 2 cm, we can consider it as an indication for surgery. And in case of ultrasound finding of calcifications in the gallbladder wall, which we call it as porcelain gallbladder, sometimes polyps again the size and number also matters. And in special conditions like patient has comorbidities of diabetes which is uncontrolled, or patient if he is undergoing some other rare surgeries or major surgeries such as malignancy also, we can remove gallbladder with stones. So the treatment is gallbladder surgery, that is the laparoscopic gallbladder removal or laparoscopic cholecystectomy, which is the standard treatment in case of gallbladder stones. The advantages of laparoscopic cholecystectomy, again it is performed using small incisions. The recovery time is very less and it causes less pain, and usually it can be discharged within 24 hours post surgery. So if you are experiencing any of the above symptoms, we usually suggest you to consult a specialist in order to avoid early complications of the same. Thank you.